Welcome to Med Student 1 Web and 2, your go-to channel for everything medical.
Welcome. Today we'll be discussing a crucial topic in the field of endocrinology. Adrenal insufficiency. This is a condition in which the adrenal glands, located on top of your kidneys, don't produce enough of the hormones needed to keep your body functioning properly. So let's start. Adrenal insufficiency is a condition where the adrenal glands do not produce enough essential hormones, primarily cortisol and, in some cases, aldosterone. This can be due to damage to the adrenal glands themselves, which called primary adrenal insufficiency, or insufficient stimulation of the adrenal glands by the pituitary gland, which called secondary adrenal insufficiency. Let's talk about adrenal glands. The adrenal glands are small glands located on top of each kidney. They produce several hormones, including cortisol, which is important for regulating metabolism, stress response, and immune function, aldosterone, which regulates salt and water balance. Impacting blood pressure, adrenal androgens, which affect sexual development and function. In primary adrenal insufficiency, adrenal glands themselves are damaged and can't produce sufficient amounts of hormones. Addison's disease is the most common form of primary adrenal insufficiency. In secondary adrenal insufficiency, the problem lies in the pituitary gland, which doesn't release enough ACTH, adrenocorticotropic hormone, a hormone that stimulates the adrenal glands to produce cortisol. Causes of adrenal insufficiency. First, primary adrenal insufficiency, Addison's disease, autoimmune disease, most common cause, where the body's immune system attacks the adrenal glands. Infections, like tuberculosis, TB, fungal infections, and HIV can damage the adrenal glands. Adrenal gland damage or removal, injury or surgery may result in insufficient production of adrenal hormones. Cancer, malignant tumors affecting the adrenal glands or spreading from other parts of the body. Second, secondary adrenal insufficiency, pituitary gland disorders, conditions like tumors or surgeries affecting the pituitary gland can reduce ACTH secretion, leading to low cortisol production by the adrenal glands. Hypothalamic disorders. Rarely, issues with the hypothalamus can lead to insufficient ACTH production, which then affects cortisol levels. Third, congenital adrenal hyperplasia, a genetic disorder that can lead to problems in the synthesis of adrenal hormones. Symptoms of adrenal insufficiency. Symptoms vary depending on the severity of the insufficiency, but they commonly include fatigue and weakness, chronic, debilitating tiredness that does not improve with rest, weight loss, unexplained weight loss and a decrease in appetite, low blood pressure, often severe, leading to dizziness or fainting, especially when standing, orthostatic hypotension, salt cravings, a need for salty foods due to low aldosterone levels and sodium loss, hyperpigmentation, skin darkening, particularly around scars, skin folds, and gums, mostly in primary adrenal insufficiency, nausea, vomiting, and diarrhea, digestive issues due to lack of adrenal function, irritability and depression, mental health symptoms including mood swings, depression, and irritability, low blood sugar, hypoglycemia. Cortisol plays a role in regulating blood sugar, and its deficiency can lead to low blood sugar, especially during stress. Diagnosis of adrenal insufficiency. Several tests can confirm adrenal insufficiency, including 1. Blood tests, low cortisol levels. Blood cortisol is measured to see if it's abnormally low. Elevated ACTH levels. In primary adrenal insufficiency, the pituitary gland releases excess ACTH in response to low cortisol levels. Electrolyte imbalance. High potassium and low sodium levels can indicate aldosterone deficiency. 2. ACTH stimulation test, a key test where synthetic ACTH is administered to stimulate cortisol production. In adrenal insufficiency, the cortisol response is low. 3. Imaging. A CT scan of the abdomen may be performed to look for structural issues with the adrenal glands or any signs of tumors or damage. 4. Autoantibody testing. For autoimmune causes, testing for adrenal antibodies can help confirm the diagnosis of Addison's disease. 5. MRI or CT scan of the pituitary. In secondary adrenal insufficiency, imaging of the pituitary gland helps identify any structural abnormalities like tumors or damage. ACTH stimulation test. The ACTH stimulation test is a key diagnostic tool used to evaluate how well the adrenal glands respond to ACTH, a hormone that stimulates the production of cortisol. How the ACTH stimulation test works. * procedure. A synthetic form of ACTH is injected into the bloodstream. After a specific period, usually 30 minutes to 1 hour, blood samples are taken to measure cortisol levels. Expected results. In a healthy individual, the adrenal glands should respond to the ACTH injection by producing an increase in cortisol levels. Adrenal insufficiency. If the adrenal glands are not functioning properly, cortisol levels will not increase adequately after the injection, indicating a problem with the adrenal glands or the pituitary gland's ability to release ACTH. Why it's important. This test helps distinguish between primary adrenal insufficiency, where the problem lies in the adrenal glands, and secondary adrenal insufficiency, where the issue is with ACTH production from the pituitary gland. It is essential for confirming conditions like Addison's disease, where the adrenal glands fail to produce adequate cortisol, and other types of adrenal insufficiency. The ACTH stimulation test is a reliable method for diagnosing adrenal insufficiency, guiding the appropriate treatment plan. Treatment of adrenal insufficiency. Adrenal insufficiency is typically treated with hormone replacement therapy to mimic the natural functions of the adrenal glands. 1. Corticosteroids, hydrocortisone or prednisone are used to replace cortisol. The dosage may need to be adjusted during periods of stress, illness, or surgery. 2. Mineralocorticoids, fludrocortisone. This is used to replace aldosterone, which helps regulate sodium and potassium levels in the blood and maintain blood pressure. 3. Adrenal androgen replacement, optional, DHEA, dehydroepiandrosterone. In some cases, especially for women, DHEA may be given to replace the low levels of adrenal androgens. 4. Emergency treatment, adrenal crisis. During times of stress, such as surgery or infection, patients may require IV hydrocortisone to prevent an adrenal crisis. Intravenous fluids and electrolyte replacement are also essential in cases of severe dehydration or electrolyte imbalances. 5. Lifestyle adjustments, salt intake, increasing salt intake, particularly during periods of stress or hot weather, to compensate for aldosterone deficiency. Regular monitoring, regular follow-up appointments to adjust medication doses and manage symptoms effectively. Adrenal crisis, Addisonian crisis. An adrenal crisis is a life-threatening condition that can occur if there is a sudden worsening of adrenal insufficiency, typically in response to stress, trauma, illness, or missed medication. It is marked by severe abdominal pain, vomiting and diarrhea, low blood pressure, hypotension, confusion or loss of consciousness. Immediate medical treatment with intravenous hydrocortisone, saline fluids, and electrolyte replacement is required to prevent shock and organ failure. Complications of adrenal insufficiency, adrenal crisis. If untreated, adrenal insufficiency can lead to a life-threatening crisis. Osteoporosis, long-term corticosteroid treatment can lead to weakened bones. Cardiovascular issues, imbalance in electrolyte levels and blood pressure can lead to heart-related problems. Growth issues in children. If untreated in childhood, adrenal insufficiency can interfere with normal growth and development. Prognosis. With proper treatment and management, most people with adrenal insufficiency can lead normal, active lives. Regular follow-ups and medication adjustments during times of stress, illness, or surgery are essential to prevent complications and ensure well-being. Key takeaways. Adrenal insufficiency is a condition where the adrenal glands do not produce enough cortisol, and possibly aldosterone. It can result from autoimmune disease, infections, tumors, or damage to the adrenal glands or pituitary. Symptoms include fatigue, weight loss, low blood pressure, salt cravings, and hyperpigmentation. Treatment primarily involves hormone replacement therapy, with medications like hydrocortisone for cortisol and fludrocortisone for aldosterone. Patients must carefully monitor their health, especially during stressful situations, and adjust medications accordingly.